Can we run through thalassemia? Yes. You have a test. Okay. Let me just run through. Thalassemia. Thalassemia. Thalassemia is derived from the Greek word called thalassa, which means sea, and what? Anemia, which means what? Relating to the blood. It is a genetic disorder of hemoglobin synthesis characterized by a lack or decreased synthesis of one or more of the four globin chains. And this results into excessive breakdown of red blood cells. Now recall that the hemoglobin has 2 alpha chains and 2 beta chains, right? Good. In thalassemia, there is either a decrease in the alpha or the beta chains, or maybe the beta chain is completely missing, or the alpha chain is completely missing. If you have 1 alpha hemoglobin chain and 2 beta chains, then there is a problem. In some cases, a patient may have 0 alpha chain and 2 beta chains. Is a problem. And vice versa, because you could have 1 beta and 2 alpha chains, or no beta chains and 2 alpha chains. And that brings us to the types of thalassemia. Alright? So there are 2 major types of thalassemia. The first one is the alpha thalassemia, and the second one is the beta thalassemia. Okay. Alpha thalassemia occurs when the gene to the alpha globin protein are missing or mutated. Just as I stated previously, if 1 alpha chain is missing, like you're supposed to have 2, but 1 is missing, so you have 1 alpha chain and 2 beta chains, then that person will have alpha thalassemia because the alpha chains are not complete. Mutation is a case where instead of alpha chain, you have something else. A person may have 2 beta chains, and instead of alpha chain, you have delta chain. Or you have 2 beta chains, and instead of 2 alpha chains, you have 2 gamma chains. That is mutation because the alpha chains are being substituted with something that is not alpha, either delta chain or gamma chain. Then there is a problem, alpha thalassemia. It's the same thing with the person who has beta thalassemia. In beta thalassemia, it is either one of the beta chain is missing. So you have one beta chain, two alpha chains. One is missing. In most cases, you may have no beta chain and then two alpha chains. The two beta chains are missing. In some cases, instead of beta chains, you now have two delta chains, two alpha chains. Or you may have two delta chains and two alpha chains. So it's either something is missing or mutated, change. Alright? Good. Beta thalassemia occurs when the related genes to the beta globin proteins are either missing or mutated. Mutation simply means change. Alright? Resulting to excess of alpha chains. Alright? Let's not go too deep into the molecular basis. Okay. But we'll now look at the clinical features of people with thalassemia. The first one is that it starts to manifest within the first 2 years of life. Now, the first few months are probably the first 1 year of the child. You may not see any symptom. The children may be asymptomatic. Okay? But from the second day of life, you begin to see these signs and symptoms of thalassemia. Okay? Just like in sickles, sickle cell disease, there is yellow coloration of the eye. You know, the white part of the eye, known as the sclera of the eye, can be yellow, will be yellow in color. Alright? Even the skin is yellow in color. There is fever, chills, and other generalized body weaknesses. Splenomegaly and hepatomegaly are present. I'm going to show you some pictures so you understand what we are talking about. Splenomegaly. Splenomegaly. It simply means enlargement of the spleen. Hepatomegaly simply means enlargement of the liver. Okay? When these organs are enlarged, it can lead to protrusion of the abdomen. So the stomach of the sufferer or the subject is usually big, like a pregnant woman. Alright? Good. There's mongoloid feature, expansion of the cheekbones. And that can make the subject or the patient to have rodent-like faces. Rodents. Okay? So there is flaring of the anterior teeth, depression of the bridge of the nose. And one of the physical manifestations of patients with thalassemia is that they have rodent-like faces. And then, what animals are classified under rodents? Rats. Okay, rats, rabbits. Okay? So they have rodent-like faces and rodent-like dentition. You see the teeth. The teeth comes out looking sharp like that of a rat. Alright. Okay. Good. The most severe form of alpha thalassemia may cause stillbirth. It simply means most times children with alpha thalassemia will die before they are born. They will die in the stomach of their mother. Stillbirth simply means the child dies in the womb of the mother. Okay? For children born with beta thalassemia, they are normal at birth, like I stated previously, but they develop severe anemia during the first year of life. If you look at this slide here, this is a slide showing excessive breakdown of red blood cells. So it's one of the laboratory findings to know when the child has thalassemia. Splenomegaly, enlarged spleen, I said that before. Enlarged liver, hepatomegaly is a common way of knowing, and that would lead to protruded abdomen. Okay? Good. Jaundice, that is yellow coloration of the eye and the skin. We look at the white parts of the eye of the young man here, it is yellow in color. The skin is also yellow in color. And then bone deformation. Bone deformation. Thalassemia can make the bone marrow expand, especially in the face and the skull. And then they become thin and brittle, which means their bones can easily break because they are so thin and soft. Okay? And then fatigue is present, tiredness as a result of excessive breakdown of red blood cells, growth problem, stunted growth, shortness of breath, and generalized body weakness. Alright? Good. If you look at the picture on the slide, you will notice the facial changes. Alright? There is maxillary overgrowth. Alright? Malocclusion of the teeth. Frontal buzzing. Okay? This area bodies out. You see the teeth. You see the face actually looking like that of a rodent. The second picture is more clearer, like the teeth looking like that of a rodent, rabbit, or rat. So, there is something called spot diagnosis. Spot diagnosis, you know? In medicine, as soon as you see a person, you may be able to detect the problem. You are just seeing a person for the first time, you run spot diagnosis. It's usually a physical examination. Okay? You say, this person has this problem. But you must also note that in medicine, whether you know the health condition of the person or not, or you are able to detect something through spot diagnosis, it has to be confidential. You don't even say it to the next person. Because I am just giving you pictures of people who may have these conditions. And because you now know, you live here, you now see somebody that has rodent-like face. You now begin to tell your friend, some of you may even go to the extent of even calling the person, hey, come. Come. Do you know you have thalassemia? You have thalassemia. And that is where you will get it all wrong. Because there are also people that can look like, okay, they have a particular problem, and when you go deep, you see, doctors and students in College of Medicine are always careful. You don't just base your diagnosis on spot diagnosis. You don't conclude. Because sometimes you will be seeing all the physical features. There is need for you to do proper laboratory findings. At least to confirm what you are thinking that this person has or not. Because in most cases, a person may have all these features showing, but they don't have the condition you are thinking in your mind. And if you go and begin to run your mouth too much, you will land yourself into a very big problem. You might go to jail for that. And that is why whatever you see, you don't just open your mouth to begin to talk anyhow. It has to be, okay, a patient comes to your lab or your clinic, the clinic where you work. Alright? And then, or maybe someone approaches you, tells you, okay, I'm having this, tells you, okay, this is my health problem. It shouldn't be had by someone else. Everything in medicine is confidential. You know, during the last election, they were saying, Tinubu is this, Tinubu has this problem, it's not sound, it's that. But if you observe properly, you will know that there is no doctor, home and abroad, that will come out and tell you, this man has this health challenge. No doctor. Because the politicians know their right. If you come out, whether you reside abroad or you're a white doctor managing his case, if you come out to mention it, you will rot in jail. Because there are laws. Anyways, you are going to do medical law and jurisprudence. So there are laws binding all health workers. You have to be careful. Okay. To summarize, this picture also describes the facial features of people with thalassemia. Like I told you, not based on physical examination, you have to do some laboratory findings. Alright? And then treatment, of course, there should be blood transfusion because of excessive breakdown of red blood cells. Okay? Removing excess iron. Removing excess iron. I told you in class that you don't give patients with this condition iron containing supplements and iron containing food. The reason is because there is excessive breakdown of red blood cells, alright, which leads to the release of iron. So they already have excess iron in circulation. If you give them more iron, it becomes a problem for them because that excess iron can cause some organ damage. So instead of giving iron, look for means to remove iron. Splenectomy, that is for those whose spleen has become so enlarged. Sometimes they go for surgery, they remove the spleen. That is called splenectomy. Okay? Stem cell or bone marrow transplant. I think I talked on this in the last class. Another form of therapy for people with this condition. Our next topic will be on polycythemia. Alright? Polycythemia. So polycythemia is the direct opposite of anemia. While anemia is decrease in red blood cell count, polycythemia is the abnormal increase in red blood cell count. So in our next class, we are going to be talking about polycythemia. Okay, are we tired? Yes. Hungry? Yes. You don't want to write this? When are we having our test? Next week. Alright. My test is very simple now, so you don't need to worry. You don't need to read. What am I asking? Your name, your local government area, the name of your favorite food, your favorite movie. So you don't need to read, you can just meet your papa to bless your pen and give you holy water to drink and come. So but we are going to announce the dates for that test. Alright? Does anyone have questions? Questions? Yes? Please, you have a test now. So